Well, it's been quite the year, and for some of you, you may not have seen family since the pandemic began months ago. So it's natural to be looking forward to getting together for the holidays, even though the CDC says to limit your gatherings. We know many of you will still want to get together with loved ones. So I spoke to Dr. Timothy Laird, the interim chief medical officer at Health First, to find out how we can do so safely.
I mean, holiday gatherings, we look forward to them all year. They're important for our emotional health, connecting with our families, especially this year. Having said that, the virus doesn't care whether it's holiday or not. The virus will transmit from person to person at Thanksgiving as easily as any other day of the year. You've got a risk, a kind of a gradation of risk that you can subject yourself to, and it can be anywhere from almost zero risk by staying away, although that imparts an emotional toll, to a mitigated risk by showing up but keeping your distance, wearing your mask.
So Dr. Laird says that that's really the key, staying smart and keeping up on the basics of hygiene, especially if you'll be with people that you don't live with, because after this kind of year, you may not want to skip out on seeing your family. It may be taking an emotional toll on you, and mental health is just as important as anything else.
And it's all important. I mean, mental health is as important as physical health, and we all need to remember that. And so that's why it's so important that we take all of that into consideration, but not forget any component, physical or mental, as far as maximizing our benefits and minimizing our risks. And so we have to really think about emotional and physical health. They're both critical. And some of the people that we love to see during these holidays are older relatives and who may be at higher risk than we are. So while we may not have as much fear for our children and ourselves, consider the oldest or sickest person in that grouping. They're who we really need to be safe for.
Now, when it comes to traveling, Dr. Laird says that once again, hygiene principles are going to be your key, whether you're on a plane or you're hitting the road.
It's not going to always be possible on the plane. In fact, usually it won't be possible to keep your 6 feet distance, but at least in crowds, in the security and in lines, you can try and keep your distance as best as possible. And so you'll be taking a calculated risk, but one that you can mitigate. The other thing to think of is be planning now for risks. You can do a little bit of research and see at your destination what are the travel restrictions. So pay attention to that. What has been their COVID numbers or percentages? Are you going to a hotspot? So you can kind of be researching before the trip. And then, as you say, during the trip, yes, when you're in public areas, when you're at rest stops, when you're getting gas, it's the hand hygiene, it's the mask wearing, it's the distancing from others, and you can mitigate your risk. By the way, we talk about COVID this time of year. Don't forget that automobile accidents go up during holiday travel. And so, leave early, give yourself extra time, plan for traffic, lay off the gas pedal a little bit, make sure everybody in your car is buckled, do the common sense things, because those are risks as well during the holiday season.
And I know our trooper Steve would echo that as well. Just to keep in mind, there's no magic that will happen when the ball drops into 2021. The virus is not going to be gone, so it's about modifying our activities in a way that we can keep a positive frame of mind while staying healthy and safe. All right, I'll send it back to you ladies at the desk. Here's